Hello and welcome to our COVID-19 update where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for joining us today.
Well, thank you for having me on the program.
Okay, Minister. Now, as usual, let's start with the latest COVID-19 vaccination numbers. Can you provide an update on that as well as a regional breakdown for us?
Well, as of yesterday, at the close of yesterday, we have 233,134 persons who would have received their first dose of one of the COVID-19 vaccine. That would amount to 47.9% of our adult population. And for those who would have received second dose vaccines, we have 108,752 persons. That is accounting for 22.3% of our adult population.
Okay, Minister. Can you provide the regional figures for us?
Well, regionally, first dose, we have Region 1 being at 59.9%, Region 2 at 43.7%, Region 3 at 47.1%, Region 4 at 49.4%, Region 5 at 50.4%, Region 6 at 56.1%, Region 7 at 47.9%, Region 8 at 32.7%, and Region 9 at 46.3%, and Region 10 at 14.6%. As you can see from the trend that we have been talking about over the last couple of weeks, we have Region 10 that is lagging and Region 8 that is really lagging. And therefore, we have to see how we can pick up the numbers in these areas. So with first dose, we still have approximately 253,000 persons more that we are aiming to vaccinate. And so we still have a long way to go. So I want to encourage people to come out and get their vaccines. We now have, as you know, the Sputnik first dose. We also have AstraZeneca for first dose and second dose, and we now have Sinopharm, which is for both first and second doses.
Okay, Minister, I'm happy that you had mentioned Sinopharm. I know we would have received a shipment last evening, early this morning. Can you get an update, a comment from you on this?
So, as you would know that during the month we spoke about the government of Guyana purchasing 100,000 doses. So the majority of those doses came in last night, and we will now do the count to see exactly how many we have received. And the rest of the shipment is going to be here by Saturday. So with that final shipment on Saturday, we should have all 100,000 in Guyana. This would allow us now to immunize approximately 50,000 people, both first and second dose. And as you know, the Sinopharm vaccine, what you give as your first dose, you also give that as the second dose. So we'll be keeping 50,000 in storage. We'll be distributing 50,000 starting from today. Those vaccines that we have received would be distributed to the different regions. And again, we are hoping that people would come forward and get their vaccine because we'll have your second dose waiting and ready for you. With the Sinopharm, we have been using a 4 weeks interval. We'll continue to do so, and the efficacy is quite good. So we expect that people would come out and get their Sinopharm vaccines.
Minister, you mentioned that the second set would be coming on Saturday. Was this the initial arrangement or was there some sort of delay?
No, it has been shipped from Beijing, and so it's going to get here. That final set is going to get here on Saturday.
Minister, and you mentioned the efficacy of the Sinovac vaccine being quite high. Can you just reiterate that for us a bit?
So when we talk about efficacy, we want to talk about a couple of things here. How effective is the vaccine against preventing infection? How effective is the vaccine against preventing severe forms of the infection, meaning hospitalization, and how effective is the vaccine against preventing deaths. And in all three of these areas, the Sinopharm vaccine is around 70 something percent. So it's really good. So it can prevent infection, it prevents hospitalization, and it also prevents people from dying once you have both doses of the vaccine. We have not seen, and I keep reiterating that we have not seen anybody who have received both doses of their vaccine having a severe form of COVID, meaning that they come into the hospital, ended up in the ICU, or dying from COVID. So it is important that people understand this and get both doses of their vaccines.
Sir, thank you for that. Now, can we speak a little bit about the cases in Region 9? I know you would have mentioned that we would have seen some spikes in some areas.
So Region 9, we are seeing new cases over the last 2 weeks or so. And we have right now in Region 9 about 354 active cases. We have cases right now in Lethem. We have about 52 cases in Lethem, 50 cases in St. Ignatius, and we have 38 cases in Sand Creek. We have also about 25 cases in Culver City, with 42 cases, or 24 cases rather, in St. Ignatius. So we have seen a spike in Region 9, and we are working to curtail that.
Okay, so the spike really is centered mostly in central Rupununi rather than in north or deep south?
Well, we have cases in different parts of the of Region 9, but we have seen these cases more in the Lethem to Sand Creek area.
Have any of these cases required hospitalization?
No, most of these cases have been mild, and those who have difficulty breathing and so, those are the ones we'll move to the isolation center. But we haven't had many people coming to the isolation center.
Okay, Minister, thank you so much for that, and thank you so much for your time today. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, and our social media platforms.